the Q&A. It's where I get to answer your questions and connect with you personally, and anything that you found confusing, you want more clarity on, you want more advice on, potentially positive shares, things you're getting out of these full body fix sessions. All of those things are fair game to share with me in Q&A. But before we get into that Q&A, I want to give you a little bit more clarity on what I shared with you at the end of today's session. And that is, it's very unique sessions that I do during the full body fix. It's the only time that I do this, and I offer free. You do have to apply, but it's free, semi-private consultation with me. This is in small, intimate groups of about 3 to 7 individuals, where I get to learn what it is that you want to achieve personally, and also learn about your limitations. We have an amazing consultation, and this is specifically for you if you're interested in having myself and my elite world-class expert team guide you through optimizing your body mechanics, helping you to get over hurdles, or maybe you don't have hurdles and you're just, hey, I want to get in the very best shape of my life in the second half of life. That's exactly what we do. We're known as being the world's leader in anti-aging fitness. So I have a very exclusive group of individuals that my team supports every step of the way. We refine your body mechanics, we custom tailor to you where it's needed, and we basically create awesomeness and high quality of life so that you can say that you're able to continue doing all the things you love to do and even improve with age. If that sounds interesting to you, go ahead and click on the chat, and on the bottom of the Zoom toolbar, go ahead and click on the chat now. So you go to the bottom of the Zoom toolbar and you scroll across until you find chat. And then you'll see this is the link to schedule a semi-private session with Robbie. We have very limited spots available, my wonderful full body fixers. And then click on that blue link, and that'll open a place where you can choose your time. If you can't find a time that will work for you, you could message Patricia and she can see if she can help you with that. But go ahead and click the blue link, and there's a short application. It's just a few questions. Not everybody gets accepted. I have way more individuals want to be in this session than actually get accepted into the session. It's free, but there is an application, a qualification process. So go ahead and do that if you'd like to meet with me in a semi-private session. And once again, that's found in the chat, and then click the link and fill out those questions. I look forward to seeing you in a semi-private session. You can go ahead and do that now. And then how do you participate in Q&A? The way you participate in Q&A, same Zoom toolbar going across, you'll find a button that says reactions. And when you click that button that has a smiley face with a plus sign on the head, says reactions, you click that, a box will open. And on the bottom of the box, it says raise hand. When you click raise hand, your digital hand will raise, and that's how I know to call on you. So I'll call on you in the order of which you raise your digital hand. With that said, let's get started in Q&A. And first up, we have Karen. Hello, welcome, Karen. And also, as we're going along, for example, like Kathy, Audrey, you don't have to do it yet, but Patricia will be sending you a link to share your video, which enables us to share with you on screen with me here, and then also for audio, but that won't happen until you're about up to speak with me. Okay, Karen, hello and welcome to you.
Hey, Robbie. Thank you again for all these things that you provide for us. It's really awesome. And every time I learn something else. So my question today was at the very beginning when you were looking at knee alignment with Keith, and you had it was like a walking lunge, and you were bringing the knee in and out over the foot. And you said, or Keith said, whatever, that you should keep the foot flat on the ground. But when your knee moves, you tend to pronate and supinate your foot. But the key for the knee assessment or alignment is to keep the foot not moving, but just to move the knee with the foot constantly flat on the floor.
Yeah, so you'd want to actually, in detail, you'd want to spread your toes. And of course, your toes for most of us are not going to function like this, but the feeling of that you're going to have in your toes is this toe spread, just like this. and then you kind of want to grip the floor. So that'll create a half dome or arch. And then from there, you might get a look at the very end of the knee motion. You might get a couple few degrees of motion, rotational or medial or lateral rotation of the ankle, of course, but you really want to minimize it, and you want to keep that foot integrity, especially. So the ankle, of course, is going to rotate a bit, but the foot integrity will stay stable and aligned. Otherwise, you're not really moving from the knee and getting that full range of motion. You're just moving from the foot, right? So you do want to keep that integrity the best you can.
So the key is to keep attention on your ankle. It's the ankle, it's a leg, the shank that we are trying to move. Is that to test
Yes.
the knee alignment over the foot?
Yes, and yes, you are correct. And also, very important when you do that exercise, understand that that's just for what I call neuromuscular retraining. So in other words, it's teaching you proprioception of like, this is misaligned with the knee in, this is misaligned with the knee out, and here's alignment. Because most of us, when we're learning this exercise, optimal biomechanical optimization stuff, it's not really apparent and really felt so well by most individuals. And this is large part of the reason of knee breakdown and issues in the hip and back and other places as well. So it's really important we get that feel. So, but the weight should be on the back leg, because it's not good for your knee to do that. Like you don't want it. It's safe as long as you don't have a bunch of body weight load on the front leg. So you want to keep the front leg like 30% of your body weight, and that 70-80% on the back leg when you do the exercise.
Oh, and also in the squatting, you have said that you could every now and then bring your knees forward towards your foot, but that's not recommended. You should keep the weight back because we move in all kinds of directions, right? But to train our brain, our neurological system, we want to be in a very stable position. So the knee sort of over the heels when you squat down, was just minimal forward motion of the knee.
Correct. Yeah, and then they're going to move and they're going to shift towards the toes, but what you really don't want, it's not like, we're going to have some immediate issue, but over time, most people will. You don't really want the knees to go past the toes, and it's more stress. It is more stress on the knee to have the knee goes past the toes, and most people are not prepared for that additional stress. So
And
another thing that was really important is so that your tibia, right, both your lower leg bones, but the tibia is larger, so I refer to the tibia. The shin bone and the spinal alignment should be about the same. So when you're squatting, the angle of the shin and the angle of your spine should match. So that's one way you can tell, am I doing correct? And then that will give you your spinal alignment angle awareness as well. Does that
very
make
cool.
sense? Yeah.
Yes. And then my last question is, because I'm hypermobile and squatting is very natural to my culture, right? I immediately, when I squat, I just go all the way down. And it's like, but I'm not really exercising. I'm just like going to my comfort zone. And so should I just stop in the middle where it's hardest for me, or where it's most comfortable for me, and just hold it there and then come back up? Is that going all the way down where I'm just relaxed?
Yeah, I would go to like a 90 degrees or slightly past 90 for you
Okay.
specifically, and hold and then come back up. Yeah.
Okay.
Yeah.
Awesome.
Not usually not to like the end where like all the pressure's on the joints and you're kind of just resting there because you're used to that. That's not necessarily bad if your body's already adapted to that. That's fine. But when you're like strength training, I would suggest you don't always go to that full end range and like rest on that position. You should do both. If you have the capabilities, you should do, right about 90 just past and all the way to the full bottom position as well, especially since you're already adapted to that. For individuals that are not already adapted to that, you would be working towards 90 and not like trying to max out going beyond 90, which could create additional excess unneeded stress.
All right. Awesome. Thank you very much, Robbie. Great class.
You're welcome. My pleasure. And lots of love to you, Karen. And next up, another Karen. Hello and welcome to you.
Hi. My question is, when I was doing the squat, my left knee was popping. Do I need to adjust to not have that happen, or do I just let it happen, or what?
Yeah, I can look at that with you if you'd like. Are you in a position for me to be able to do that?
Well, I'm in my office, which is very restricted. I was having a tough time doing the things on the floor and working around, but I mean, it pops. I don't know what else to say. It's just when I squat down, and I can do it, but it
Yeah.
pops.
Yeah, it would be best if we can look at your alignment and kind of, guide you into what's going on. So yeah, because one thing is how you think and feel that alignment is, and another's actual alignment. And usually when you start this biomechanical optimization stuff, it's not they're not aligned. One is how you feel, and one is actually what's happening, and they're two different things. We will eventually get those calibrated to be matching, and that's a large part of this process. But right now, my guess is that they would be pretty distant. So I would love to, like, if you have an area where you can back away from the camera a little bit and do a squat, I could help you with that. And we can also come back to you if you'd like to create your setup and then go through this. That could work as well.
So I can get it over here. Or if I tilt it down, maybe. You still can't see my knee.
Not really. No, not really. No, it's not gonna help.
I don't think I
Yeah.
can get back far enough. Sorry.
It's okay. Yeah, you might be able to adjust your camera in your room just a little bit, and then we could come back to you for that. Did you?
Well, tomorrow I'm going to do it in a different room because this was
Okay.
kind of like difficult.
Yeah, Wednesday.
Or yeah, yeah,
Wednesday. Okay.
yeah,
Yeah.
perfect.
Like if so, no, your knee shouldn't pop. It is. Some of us have what's called crepitus, so it's like a little bit of like almost sounds like Rice Krispies like noise in the knee.
Yeah.
It's not really a pop though. It's more a little bit of like a light crackling, and this is not necessarily bad. It is somewhat common, and it's mostly like air gas bubbles within the knee joint popping. But that I don't think that's what you're talking about. I think you're getting like a
This.
joint shift pop. So
Yeah.
I would want to talk to you about muscle activation and positioning. You're probably getting of course, some instability at the knee. So if we have the right foot alignment to knee to hip, and we really have the right muscle activation, and then we start with controlling the range of motion to not pop, and then slowly progressing past that, that's what you'd want to do. So that's what I'd want to help you like figure out and really see the specifics. Plus, I think everyone in session will gain a lot from that as well. So
Okay.
we could do that today. I could come back to you, or we could do it on Wednesday. Either way.
I think Wednesday will be better. I'll be in a different room.
Okay. Awesome.
Okay. Thanks.
But yeah, that's our way forward. And no, I'd like to try to keep you out of the pop if possible.
Okay.
Yeah.
Thanks.
Awesome. You're welcome. Lots of love to you, Karen. And Kathy, hello and welcome.
Hi, thank you so much, Robbie, for your generosity and your time of doing this. This has been excellent. I have a couple questions for you. So the first day you worked on the foot stability, and I do have more of a starting of a bunion on the right side that I've been trying to do some mobility with that great toe. But with doing the exercises you showed with gripping of the great toe and then lifting the three middle toes, I started to notice a lot of cramping in my arch, my foot. And I was just wondering if that's normal and just to keep working through that. Maybe use a lacrosse ball and roll it out the plantar, fascia with that and just keep going on it. And curious as to if you've had bunions correct in that regard.
So Totally normal. First of all, yes, bunions can be corrected the majority of the time. And then, yes, it's also very common to have some cramping, especially light to moderate cramping in the foot when you first start doing those 3 toe raises that you're speaking of.
Mhm.
And yes, I would agree with doing combining strength. So that's actually a strength training exercise for your foot and a motor control retraining exercise for your foot. And so I would suggest you combine that with massage and stretching. A lacrosse ball would be a good way to warm up into that. Just do it for like a minute on each side and just rolling that ball all across the plantar fascia. But also doing the plantar fascia self-applied massage that I taught in session 1. So you take the toes and you'd pull them back and you gently massage the plantar fascia, also bringing the toes towards the foot and massaging the tissue with the toes in a not lever stretched position, right? Because basically you got bones going in opposite direction. When you take the toes and you pull them back and stretch and massage, this is going to be a lever plus a local stretch. So you're stretching the tissues from the lever and locally with a palpation of the other hand, right? So so that would be more advanced. So you start with the toes down, kind of massage through, then you could go long, massage through it, and then do a set of that 3 toe exercise. Then you'd come back to toes down, massage, toes stretch, massage, back to a set. So you'd create a circuit, and that'll start helping with the cramp, and also, most importantly, getting the tissue more pliable and be even more effective.
Okay. No, that's excellent. Thank you very much. I have 2 other questions if you have time. I had a medial tibial plateau fracture that was insidious. Like it just came on. I've been a runner my whole life. With it being on the medial side and it just happening spontaneously, um, this was a couple years ago. They wanted me to do, surgery and cut part of my bone, an osteotomy, and I was like, I'm not willing to do that. So I did some PT and had rehabbed it, but I still have some pain on that medial side of where that fracture was when I'm walking or if I'm doing some sprinting. And so forth. Do you think it's just that strengthening that medial side of my knee to be able to help to support that better? Or why would I still this will be 3 years later, still having that pain?
It's two things. One is it's probably caused from overuse, and overuse is a tricky term. So it's overuse doesn't necessarily mean you just overused. Like overuse is if you have some biomechanical deficiencies and you're a little bit out of alignment, and then you multiply that with the load and stress of whatever activity you're doing, you can run into overuse earlier than if you really had like near perfect alignment and then did the same volume or intensity of exercise. So overuse is often really misaligned plus some use that took the individual past the point, and now we call it an overuse injury. That's usually what's actually happening. So with that being said, I would really look at your biomechanical specifics, that your feet are functioning properly, that you have good alignment, that the patella tendon is aligning up with the second and third toe, that when you're running, you have good pelvic alignment and control, that your posture is good. I would want to look at that when you're running, you have more of a midfoot strike with your running and the size of your stride. I would be looking at those things and making sure that we're all optimized mechanically speaking. So I would get a better track on, first of all, you should do that. Second of all, you should look at and see, okay, is there a point that I don't get symptoms? Is there amount of volume of running that I don't get symptoms? And then I would try to keep yourself above that and do more frequency with smaller bouts, while also doing other exercise to strengthen and create better alignment in that area. And then I would encourage you to, we do this in our advanced training structure for our VIPs, and that is we do a BFR training. So you do a moderate blood flow restriction with a cuff device on the upper limb. And by decreasing blood flow to the area, you actually get heavy strength training results while doing light strength training. It's a very advanced methodology that we use in our advanced protocol, which all VIPs eventually progress into. So there's quite a bit of technicalities to that, but it is something that I would include for you as part of your progressional protocol.
Yeah, the BFR bands are amazing. I've done those. I started doing those after my injury. So that one of the PTs that I was working with had those and suggested I get them. So yeah, those are amazing. And I think that you're right, though. I think that's probably part of it is the alignment piece. And that's where my third question is with the hypermobility. Like I don't have Ehlers-Danlos syndrome, but I was a dancer, I was a gymnast, and so I think that with that hypermobility piece, it's I've been always told like, strengthen, 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 instead of doing more stretching. And so how do you have you worked with people who have hypermobility and know the range in which to, and like, and then my daughter too, I was thinking about, she's a tennis player and I'd love for her to get on your program. But she does have like more EDS because she's like super hypermobile. And do you have like a subset group of people that you work with that have these issues?
Yes, absolutely. So one of the things that we want to look at with hypermobility or Ehlers-Danlos is, first, do you have, okay, you might be hypermobile in some areas, but are other areas restricted? So we'd want to figure that out with actual tests and measurements, which we do in our VIP training system. So then we would look at, okay, just the areas, if you have some areas restricted within the lower body, we'll do certain types of stretching for just those areas, but the other areas we want to strengthen. So we want to have more functional stability patterns and having good range of motion, but building more functional stability. So you want to do as much stretching. Your stretching would basically happen during strength training, minus for the area that you may have actual hypomobility, because just because some tissues are hypermobile doesn't mean others won't be hypomobile. So we're going to start creating alignment by being really specific about which tissues are hypermobile and which tissues are hypomobile.
And you're able to do that all online?
Yeah. Oh yeah. Yeah.
Okay.
We're the best in the world at doing online anti-aging fitness training. We measure to the actual degree, toe to head. Yeah. And every VIP has their personalized mobility prescription to address their mechanics. And then our protocol for body mechanics is everyone's a human, so everyone should go through and optimize the same things. But as we approach that system, then there's some personalization that's needed to get the best results from that. So, and then that's where we go personalize, whether exercise regression, progression, different types of adaptation. Then we create that as well. And it's basically a guided journey multiple times per week done together.
Okay. Well, thank you so much, Robbie.
Yeah.
It's really helpful. I really appreciate it.
You're so welcome. Lots of love to you. And if it makes sense for you, come see me in a semi-private consult. And Audrey, hello, welcome.
Hi, good morning.
Hi.
Thank you
Good
so
morning.
much for all this. It's been great information. And actually, a lot of the questions I was going to ask have already been asked. I'm coming off, I was hypermobile, overuse injury in my knees. So I'm struggling to get the mobility. But I found, when we were doing the test, where a lot of my weaknesses are. I still feel like when I'm squatting, I'm always going too far. Like my knees are always over my toes. How do I get my weight? I feel like I can never push onto my ankles or my heels when I'm squatting or anything like that.
So that comes down to a few different things. One of the things is ankle mobility. So your body will try to naturally, if you have a deficiency in the ankle and mobility for dorsiflexion, so the foot coming back towards the shin, your body will want to stick your butt back more, because then you don't have to use as much ankle mobility. You can make that mobility more so come from the hip, and the shin starts to stick backwards a little bit by going butt back. The other thing is just the fear, the natural fear of falling doing a squat. And so with this, what we do, like we do this in our VIP training system, is we don't start squats from here and then go down. We start squats from the bottom, because this is the area of fear for most people, or instability or lack of good quality motor control. So we start from a seated position and then stand up with good quality, and then come back to the position that you're already getting familiar with. So it's alignment and coming up, and you can use your arms for like a counterbalance, which will help keep the torso upright and also get the pressure onto the heels a bit. So it's looking at the mobility, it's starting from a seated position, it's reaching out, and you can even go, if needed, to you can regress the exercise a bit and use a heavy band. So, and Patricia can drop the link for these bands. So it's some of the bands we use, some of the resistance devices we use in our training protocols. And you use a heavy band. It's one continuous long loop band. You attach it above a doorway, and it comes with a door anchor. It's very easy to do. You attach it and you hold on to it. So now you could sit in the seat. Now you have some stability from your arms, and you can begin to retrain your motor control pattern and be comfortable with that position with less load. And that way you're really training your motor control system. And over time, you will get a better, more comfortable, more aligned squat, more proper muscle activation. And that's the way that we would progress that.
Okay, thank you. I appreciate that.
Of course, my pleasure. You're welcome, Audrey. Did you have any other questions? Oh, sorry. Let me give you a link to unmute there.
I think that I mean, like the other questions, because I was hypermobile, I had over injury, I stand on my feet all day long. I'm up and down stairs. I do a lot of stuff, but after these injuries, I haven't been able to recover as well. And so, and I still find myself compensating. So I think the last question, I mean, just really helped. And I do have a session with you later to talk to. So
Awesome.
okay. Yeah, appreciate you.
You appreciate you too. Lots of love. Look forward to seeing you soon. And Serena, hello, welcome.
Hi, Robbie. Thank you so much. What you just showed us today is so helpful. I came online because my husband, I'm looking for solutions to help him with his hip issue. He's got everything that you said is wrong today is what he's got. He's going through exactly everything. So I'm persuading him to come and join me and listen to this. It's really very useful and helpful. And he was about to go to bed. I said, come back and ask questions because others will learn from your issues, and we can learn from your experience. And I mean, I did exercises that you showed us, and I have no mobility issue, but I've had a torn meniscus. I'm managing that, but more important is this man here who sometimes have stress on his hip and has problems walking, waddling more than walking, which is quite common.
I do a lot of compensating, and unfortunately, I got a diagnosis of quite severe osteoarthritis, and it's really been slowing me down. And I just got on the floor with the best of intentions to join some of your exercises, but I always end up at the wrong angle. And yeah, I mean, but all joking aside, I mean, it seems to be a one track to the doc, and I've been managing it for 10 years actually. I don't want the drugs, and once I really can't stand the pain anymore, then I feel no choice. But I've done a lot of management, and a lot of what you are putting forward there is really good, and I've done a lot of it, but just finding that I just can't do it any longer, which is always a shame. And it's not really a question, but I just really kind of wondered if you had any general comments on people who are at that situation of getting to the point where they feel there is no other alternative but to get surgery, which I understand these days can be pretty good. So I'm not scared of that, but I just wanted to delay that as long as possible.
Well,
where were you 10 years ago?
Yeah, I would say a couple really powerful things. One is I think most people have not, I would say like 98% of people have not really fully addressed optimizing their biomechanics. Like they've tried different things for a while, but not fully started with the proper protocol and approach, and started slow and easy, and then adjusted all their mobility factors where they have restrictions. You know, even adjusting diet can be really important, so that become more anti-inflammatory. That can be part of it, and also the mindset around and connecting with your body. So you know, like if you really want to go to the nth degree, you need to address each of those things, and we can help you do those things as a VIP. It's a more depth, right? A lot more depth than the full body fix. So yeah, that's what I would suggest. Like if you really want to find out, you would want to do an approach that fully gets you into optimizing your body mechanics before you say, well, exercise didn't really work. And you know, that typically takes anywhere from, you know, 3 to 9 months, just depending on the individual and how consistent they are, and how much issues they have, and how their body's intertangled with this mental, emotional, physical, biomechanics wise. So that's step one. Step two is to understand, like, okay, and I give this analogy all the time, so you may not have heard this, but having a joint replaced, whether it's knee or hip or shoulder, we have VIPs with shoulder replacement. Sorry, had to adjust my mic there for a second. So it's very synonymous with like a tire wearing out on the car, right? Sometimes the tire, the inside tread or the outside tread of the tire can wear out. The rest of the tire is pretty good, but the inside or outside wears out. Why? Because of the misalignment of the car. It's not because of the tire, it's because of the misalignment in the car. So the tire gets replaced. Now that's synonymous with having the joint replaced. So, but the misalignment is still the misalignment. And so when you go and get surgery like that, it's although it's going to fix things, clean things up, give the joint more smooth, free flowing range of motion, but it's trauma. It's a major trauma to the body to have surgery. So you're going into a surgery with something called kinesiophobia, which is fear of motion, fear of movement. Because of the pain and all the mechanical issues that have gone on, it's really been hardwired into your neurological system. Now you have an even bigger acute trauma from the surgery, and now your tissues are trying to recover. And most people, they do a halfway job. They go and see the PT for the required 6 weeks, 7 weeks, 8 weeks, whatever it might be. And then they kind of fade away from it. And then they say, well, it's better, but it's not really where I want it to be. So what we really need to do is address body mechanics to the nth degree before the surgery. If you're going to have a surgery, find out if you actually need to have that by optimizing your body mechanics. And then after the surgery, really get serious back into body mechanics optimization again. That's how I have individuals that have had surgery done, and like their results are at the 99.9 percentile. That's like a massive life transformation. Their surgery is really easy. They recover really easy. They get back to full functionality at like a 10x level, because it's both. It's the if you need the surgery, but also optimizing your body mechanics. And I would argue the individual that has the surgery needs to optimize their body mechanics even more, because it's even
Definitely.
more
For
trauma.
sure. Mhm.
And your nervous system senses, oh, we have had this pain, we've had this major issue in the body, whatever it may be. So what your body says, in your neurological system says, oh, this is a problem area. Don't send as much electrical current. Don't turn on the tissues. Don't use heavy strength, and actually shut down strength, because we have a dysfunction here that we're going to injure it if we put a lot of pressure. So your neurological system will get weaker connections, then the tissues get stiffer, then the overlying fascial tissue starts to change the tissue mechanics as well. So you need to unwind all that. You need to create good quality mobility patterns. You need to have good quality motor controls training that creates stability. And that's where you start to develop actual athleticism and good feeling, youthful functionality from.
Mm.
Yeah.
Yeah, it makes a lot of sense, Robbie, what you're saying. It really does. So I think we all got a lot to think about, but we started well with you, I think, and I don't see any reason why we can't continue. So
I've just signed up for the VIP with you, so
Awesome.
we will both come on with you if it's okay.
Of course.
And yeah.
sure, yeah.
Any other question?
No, I don't want to take up the time of the other people that have very good questions too, but that is very helpful to put it in some perspective. That it's not like a zero sum. It's not like, oh, you can't do it at all. It's like you can, but then you need to think about how you're going to manage it, and that makes a lot of sense.
Yes,
Yeah.
sir.
So
Yes,
you're
sir.
talking about doing some biomechanic work before the surgery and see how you function, and then after the surgery, back to the exercises as well.
Yeah, a lot
Right?
of
Yep.
we have
That's
a
my
lot of
understanding.
we have a lot of VIPs who come in and then they think they might need some procedure, and then you know what, I don't need it. My body's so much better. We have others who do still, they have like total bone on bone in their knee, and yeah, they got a lot more better, they got more functional, but they still need the surgery, and then they come back and they have like amazing results after the surgery, because now they have a cleaned up joint plus optimal body mechanics, and now they literally feel like so much younger, so much more functional, and it's it's like just short of magic, basically.
I'm that guy. I'm the bone on bone guy. I can tell you all about it. I've got a little person living in my hip, all independent.
Let me tell you one thing. What is a man without a wife?
Me, nothing. She told me to say that.
Good job, Serena.
I don't even wheeling him around in a wheelchair when he's 95. That's why I have ulterior motives.
I heard what I wanted to hear, so you certainly will see you again. But sorry, we're on the other side of the world to you, so I really got to get up to work in the morning. So I'll say bye-bye.
Thank you so much, Robbie and Patricia. You're amazing. You're such a good help and very assuring and comforting. Thank you. I've sign on, and then we'll meet with you. I don't know when this VIP is, but you let me know, or is it right after this, or
Well, it's at
another
the
day,
time.
right?
I'll have Patricia message you in the chat, and because you may or may not have already signed up, and she can chat with you about it. But yeah,
I just click
pick a
on the
specific
VIP.
time.
Yeah.
Yeah.
Okay. Thank you
Yeah,
so much.
So she'll message you for clarity on that. Awesome. Lots of love to you, Serena. And Sonia, hello and welcome. Sorry, 1 second. Got to get you a link to unmute. Sonia, 1 second there. If you can click the link to unmute.
Unmute. I'm so sorry.
There we go. I can hear you. All good. All good.
I didn't want to take up the time, but at the same time, I want to just underscore what you're saying. I've already signed up for VIP, and I'm going to have a session tomorrow morning at 9 o'clock. I am your perfect poster child because I have foot problems. I've had knee replacement, bone on bone, right knee. I'm halfway through the healing process. It's like 6 months. It takes a whole year, and it's supposed to be healing. Although I'll probably check with the surgeon at some point soon, rather than wait for the rest of the 6 months. And the other knee is supposed to be just as bad, but it didn't hurt as bad. So, and I've had a lot of hatha yoga and physical therapy, but it was all like discreet. And the physical therapy for the knee surgery was just dealing with the knees, wasn't dealing with the feet or with my hips or with the rest of me. So I was looking for, this is kind of a godsend. I was looking for exactly what you're giving. I was looking for a one-on-one. It's not going to be a one-on-one, but let's see how it works. With someone who will help me with alignment. For one thing, I tend to overdo, and so I have to not overdo and hurt myself. And I have to be more in touch with my body. And I have to have someone who is telling me, yes, you're in good alignment. No, you have to adjust here. And this is what you're saying you're going to do. So I just wanted to put that out there to whoever needs to hear it. And I
Thank you.
realized that yesterday at the first session, because you were talking about feet, and I have foot problems. I'm sure that's thrown off all the rest of me. So that's
having someone analyze you when you exercise and then retraining your higher centers of your brain around the concepts of alignment and positioning in your body, and being able to create a keen sense of awareness of your positioning and your alignment in exercise, which is kind of like the practice area, if you will, then ends up stemming to all other areas of your life. And then your exercise gets better, and then all the results start compounding on themselves. And we typically see that really shifting around the 3 to 6 month mark in a big way. Of course, there's, it's results in 1-2 weeks, and there's shifts that you're going to feel, but as those compound, then you really start to see a big difference. For us, we see like rehab from a knee, like max about 6 months from a full knee replacement. Often we've had results with like 3-4 months, they've back to way beyond functionality from before the knee surgery. So yeah, and yes, that's exactly what we do. We analyze you every single session, and there's a lot of personalization what we do. Yeah, there's a lot of personalization for sure.
I'm looking forward to the session tomorrow.
Me too. Me too. Thank you for sharing with me, Sonia. Look forward to seeing you then. And Patricia, if anyone else has any questions you'd like to ask, well, we might have time for one question. Actually, we're going to be Patricia, I'll let you announce what we're going to do next. You're so much more pretty than I am, so we'd rather look at you than me.
All right, full body fixers. So if you came here late and you were watching the Q&A and did not have the opportunity of watching the session that you signed up for, just stay in the meeting and we are going to start session 2, which is hips and knees, in about 6 minutes. So just stay in this room. And if you're going to log off, we are looking forward to seeing you on Wednesday for session 3, which is pelvis, lower, and upper back. That's going to be an awesome session. And we have 3 more sessions. Wednesday, Friday, and Saturday is our breakthrough session. You certainly want to be here for that. And thank you so much for this journey together. We really appreciate all of the questions, and we get to know you better. This is Robbie and I favorite part of the Full Body Fix are all the amazing people from all over the world connecting. It's really, really amazing. Thank you so very much for being here with us. Much love to you, and I will see you now or on Wednesday. And friendly reminder, you're going to receive the replay for this session. Every session you're going to receive the email at the end of the day. So around, for us, we are Mountain Standard, around 4 p.m. Mountain Standard, you're going to receive the email with the replay and also the checklist. Okay?
Lots of love. See you soon.